Hey everyone, and welcome back to The Explainer. If you've ever felt a little anxious or maybe just kind of in the dark about routine women's health checkups, well, you're absolutely not alone. Today, we are taking all that mystery away. We're going to demystify the pap smear process together, specifically looking at exactly how it's handled at Paradise Medical Center down in Miami. That way, you'll know exactly what to expect before you even walk through the door.
Okay, let's dive into this. Here is our super clean, simple roadmap for today. First, we'll look at the life-saving screen itself. Next, the screening age guidelines. Then, we'll walk through your 4-step visit, hit some common FAQs, and finally wrap up with a little bit about Paradise Medical Center.
All right, Section 1, the life-saving screen, catching changes early.
So a pap smear, formerly known as a Papa-Nicolau test, is basically a test that collects a tiny sample of cells from your cervix. But I really want you to focus on the last part of that definition, long before symptoms appear. That's the whole magic of this, right? It's all about screening for precancerous and cancerous changes proactively. It literally gives you the ultimate upper hand.
In this quote just brilliantly illustrates the point. When paired with HPV testing, it is one of the most effective cancer screenings in modern medicine. Think about that for a second. This routine, everyday checkup, it's actually an incredibly powerful tool for your future health. It is modern medicine at its absolute best, stopping illness before it even has a chance to truly begin.
Moving right along to Section 2. Screening age guidelines. When exactly should you get tested?
Finding your bracket is super simple. If you're between the ages of 21 and 29, the standard is pretty straightforward, a pap test every 3 years. Now, if you're in the 30 to 65 group, you've got a couple of options. You can either do a pap and HPV co-test every 5 years, or just stick to the pap alone every 3 years. So as you can see, it's a highly predictable, incredibly easy to follow timeline.
Now, of course, while that timeline covers the vast majority of women, there are always a few exceptions. If you've had abnormal results in the past, if you're dealing with immune suppression, or if you've had DES exposure, well, you're going to require a more individualized schedule. And that's totally okay. Your provider will simply customize a timeline to keep you specifically protected based on your own unique health history.
All right, Section 3, your 4-step visit, the patient journey.
The clinic actually has this really organized, super reassuring process from start to finish, completely removing all the stressful guesswork. Step 1 is check-in. They'll review your brief history, verify your insurance, and handle the bilingual consent. Step 2 is the actual exam, where they use a speculum and a really soft brush for collection. Step 3 is lab processing. Your sample goes straight to an accredited Miami pathology lab for cytology and HPV testing. And finally, Step 4 is results and follow-up, where you get a clear, plain language plan.
Now, what's really interesting about this next bit is the time it takes for Step 2. That actual physical exam step typically takes under 2 minutes. 2 minutes! You probably spend way more time just scrolling on your phone in the waiting room. For something that causes so much mental buildup and anxiety, the procedure itself is literally over before you know it.
And the good news keeps rolling into Step 4. You're not going to be left agonizing and wondering for weeks. Results are ready in a really fast 7 to 10 days. Plus, they communicate those results with a clear, plain language plan in either English or Spanish. So the anxiety of waiting is completely minimized, and you actually understand what your results mean without needing a medical degree.
Let's jump right into Section 4. Common pap smear FAQs, clearing your doubts.
Okay, this is a big one. A lot of women wonder if they need to do anything special before heading to the clinic, like, do I need to do anything to prepare? And the short answer is yes, just a few really minor things to keep in mind. Preparation just requires following a few super simple rules for about 24 to 48 hours before your test. Basically, avoid intercourse, avoid douching, and avoid using any vaginal products. Also, try to schedule your appointment for a time when you aren't menstruating. These are really easy steps, but they are absolutely vital because they make sure the lab gets the clearest possible sample to evaluate your health.
Next up, the financial question. Does insurance cover pap smears? Let's be real here, this is very often the biggest hurdle for folks seeking preventative care. They want to go, but they're stressed about the bill.
Well, you can breathe a huge sigh of relief here. Under the ACA, cervical cancer screening is covered as preventive care. That means zero copay for most major plans. We're talking big ones like BCBS Florida, AvMed, Aetna, Cigna, United Healthcare, and Humana Medicare Advantage. Preventive care is supposed to be accessible, and this coverage totally reflects that.
Now, for the Miami and Westchester community specifically, this next question is incredibly relevant. ¿Hacen la prueba de Papa Nicolau en español?
Basically, do they do the pap smear in Spanish?
And the answer is an enthusiastic yes. Paradise Medical Center provides comprehensive, fully bilingual care. The entire visit, literally all the way from taking your clinical history to discussing your test results, is offered completely in Spanish by a bilingual provider. So absolutely nothing is ever lost in translation.
Let's address the scariest question head-on, because, avoiding it doesn't help anybody. What if my pap is abnormal? We really need to demystify what happens if the results aren't perfect, because an abnormal result absolutely doesn't automatically mean cancer.
Look, if you do get an abnormal result, it just triggers a really clear supportive action plan. The clinic will explain exactly what the result means. If you happen to need a colposcopy referral, they'll coordinate it for you. They will walk you through the follow-up step by step, so you are never, ever left trying to figure it out on your own. You have a true partner in your healthcare.
And that brings us to Section 5, about Paradise Medical Center, your local resource.
So Paradise Medical Center is actually this fantastic dual clinic practice founded by Dr. Teresa Moreno, a doctor of nursing practice. They offer comprehensive primary care, think annual physicals, wellness exams, and in-office labs. But they also offer advanced medical dermatology and aesthetics. So that covers skin cancer screening, Botox, lasers, PRP, the whole shebang. It's an amazing local resource for a true head-to-toe evaluation. If you're ready to schedule your screening or just want to check out their other services, you can easily reach out. You can call them at 305-676-8217. The primary care clinic is at 8380 SW 8th Street, and the dermatology and aesthetics side is right next door at 8364 SW 8th Street in Westchester, Miami. They make it so incredibly easy for you to take that next step.
We've seen how effective this test is, how fast the exam really is, and how completely supported you are through the entire process. So I just want to leave you with this one powerful question. Are you ready to take 2 minutes to protect your future? Don't let fear or confusion hold you back from preventative care. Make the call, book the appointment, and take charge of your health today. Thanks so much for hanging out with me for this explainer, and I'll catch you in the next one.